Right, we've received another question about case conference items, and the question was, is there a multidisciplinary case conference item that can be built in intensive care? And the short answer to that question is, unfortunately, there isn't. So there are literally no case conference items that are applicable to a specialist providing care in intensive care. Almost all of the case conference items are physician item numbers, so you have to be a fellow of the Australian Physician College, FRACP, to be able to claim those numbers. And they mostly relate to outpatient case conferences for patients with cancer, with chronic conditions, with very specific disorders. And there are very, very specific descriptors that go along with the case conference definitions about the people that need to be involved, the number of people that need to be involved, documentation requirements. And in essence, there really isn't a single item number that you could claim for organizing or managing or being part of a case conference in intensive care. And if we take it a step back and look at what the 13870, 13873 item numbers are supposed to be covering for the intensive care admission, as I mentioned in the past, they do cover all attendances by the clinicians on the patient. And if you're participating in a case conference, that would be considered an attendance on the patient or part of the patient's care, which you've already claimed under the 1387 or 13873 item numbers. So unfortunately, there is no multidisciplinary case conference item number for intensive care.